On behalf of the Seton Network, my name is Luke Jernagan. I'm an Episcopal priest and a member of the Seton Network board. Here to begin hosting our webinar today on the role of the church in promoting vaccines. And we have three speakers today, Father Pierre-Andre Duvert and Dr. Winsome Grant from St. Luke's Church in the Bronx in the Diocese of New York, and Dr. Eleanor Bergquist from St. Louis, who is an epidemiologist. And as so many of our churches are, continue to wrestle with reopening and hopefully returning to normal and encouraging people to become vaccinated, the story of St. Luke's in the Bronx is a great story that we should all hear, that really helps to teach us about different ways that all of our churches around the country can be more active. So we'll hear from them about their experience. We'll also hear from Dr. Bergquist about trends happening around the country right now and in ways that our churches can continue to be helpful and useful and encourage vaccinations as part of our gospel witness. So with that in mind, I'll let our panelists introduce themselves. Father Pierre-Andre, why don't we begin with you?
Yes, I'm Father Duvert, and I'm the rector of St. Luke's in the Bronx. I've been with St. Luke's since 2012, and it's a great place to be. I will say more later.
Okay.
Yeah. Okay.
Dr. Grant.
Dr. Winsome Grant background, nurse practitioner with a PhD in health administration. I've worked in the healthcare industry for over 40 years. And I'm a member of St. Luke's Church and a member of the vestry at St. Luke's.
Hi, I'm Eleanor Bergquist. I am Eleanor Bergquist. I'm an epidemiologist. My current role is at Resolve to Save Lives, headed by Dr. Tom Frieden, who is a former director of the CDC. I am a program advisor for the United States COVID response team. I work in Midwestern jurisdictions and on the East Coast virtually from St. Louis. My PhD is in behavioral science, and I have a master's degree in medical anthropology and another one in master's in science of public health in parasitology, which is not the study of Paris, it is the study of parasites.
Both are interesting topics.
Mm-hmm.
Okay, so when we were first beginning to think about putting this webinar together, some members of the SEAT board were reaching out to different parishes around the country, looking for people who have had unique ministry in terms of encouraging people to be vaccinated. And St. Luke's in the Bronx, you've had quite an experience. Not only are you encouraging those in your community to be vaccinated, but you have served as a site for vaccinations. So I'd love to hear from the two of you, Father Duvert and Dr. Grant, how that came to be and what your church's experience has been these last few months.
Before we talk about vaccination, I would like to say a word or two about what I would call a theological framework that explains the things that we do. And in the Gospel of Luke, chapter 4, there is that beautiful passage where we learn that the fact that Jesus going to the temple, and the book of the prophet Isaiah was given to him, and he read and said, "The Spirit of the Lord is upon me, for he has anointed me to set the captives free and give sight to the blind," and so on and so forth. And then in the gospel passage that we had 2 weeks ago, which was taken in the Episcopal Church, which was taken from John. We are also told that Jesus met with the disciples and said, "As the Father has sent me, so I send you." And our reading of the two is that Jesus was sent to bring freedom to the captives and sight, recovery of sight to the blind. It's more about mission. And then the second one, reminding us, inviting us to realize that just as Jesus was sent to the mission, that we, the church, is also called to the mission When in the Anglican Church, in the Anglican tradition, we have the beautiful liturgy of which we are very proud. And at times we can become so proud of the Anglican ethos that we forget that it is not the only thing that should be the mark of us being Christians, that we are called to be missionaries, quote unquote, for Jesus. So at St. Luke's, we understand that we have a call to do mission. So everything that we do centers around that theme, the call for us to do mission, to be just as the Father has sent our Lord. We understand that we are sent. It is from that angle we look at mission, and it is that what gives us the drive to do the things that we do in the community. So vaccination is part of a larger campaign where we do feeding programs and also health education. Dr. Grant will talk more about that, or housing development, and all a series of things. And we are also involved in international outreach. We in the Caribbean, in Africa, but it's all part of that understanding that the call given to us is not simply to come and worship and we are what is known in the Anglican Church, high church, incense and bells, but also to be witnesses for the Lord. So that really gives you the framework for what we do. And I'm gonna let Dr. Grant speak more about vaccination and the other things that we do as part of our mission, especially when it comes to healthcare.
We see not only the religious part of the person, we see the person as a whole. And if in being healthy and in being religiously healthy, you have to be physically healthy too. And in looking at the entire embodiment of the person, we also focus on their general health. And we do not propose to put vaccination of COVID in a container, and this is what we are doing. We are looking about your health, so you can be healthy, so we can be healthy, so the community can be healthy. And that is the approach we have to getting vaccinations done at St. Luke's. We do not only do what I say, but we set the example by getting ourselves vaccinated and getting them to realize that we are not dying from vaccinations, but we are healthy, carrying on our daily lives. So we are leading by example. We are not just saying to you, go out and get vaccinated. We are leading the process of getting vaccinated ourselves.
You were telling me in a previous conversation that there are many in your community, not just in your parish, but in your surrounding community, that are very hesitant to be vaccinated. So that's where your witness really plays an important role.
Yes. When they see us get vaccinated and having the vaccine in the church is a way of endorsing that this is something good for you, good for the church, good for the community. And it helps.
I'm sorry, go ahead.
It helps to have them buy into the fact that this is something that I am doing, not only for myself, but as Father Duvert will explain, for my neighbors, my family, and my friends. Because whereas it prevents me from getting sick and dying from the disease, I don't know if I can get it and spread it to somebody who's not vaccinated. So let us get vaccinated so we can all be healthy together.
So we look at it
So
from,
how did it come about that you all, I'm sorry, how did it come about that you all became a vaccination host site? Because I know a lot of other churches have wanted to do that and they have not been able to make it happen.
Dr. Grant?
First, we appealed, we found out who was actually giving the vaccines. Was it the Department of Health? Was it the local political body? Was it the state? And we found out eventually that it was the state. So we wrote all these letters to all these people and volunteer our site as a prospective vaccination site. While that was in the works, the state looked back and said, oh, we came there for testing and antibody testing. Why don't we go back there? And so another evaluation was done of the site because the state had to come out to evaluate the space in terms of doing the vaccine and set up the space in order to convert the area into a vaccination site. And so they came out and they inspected and decided, yes, this is a good place to do the vaccine. Plus, it is very central. It can be reached by bus, train, walk, car, any means of transport. And it's very central and very open. And when one realizes that it is happening in a safe haven, as I call it, because they consider the church a safe haven, they are willing to buy into the program.
If I may add something to that, if I may add, because I had someone who was very hesitant. One thing that I can share with you in the Black community, because of past experiences, there is that hesitance or that mistrust that is usually there, and because folks don't want to be used as guinea pigs. And one person testified or shared that she was so comfortable to receive the vaccine at St. Luke's because knowing that if it is at the church, it's something that she could trust. Mm-hmm. Whereas in any other place, she would be hesitant or she would not trust that place, but to be at the church. So the church plays a role in creating an atmosphere where folks can trust what is being offered. But also what we can learn from the thing is that it's not something that happens overnight. It's not an overnight thing. The church has to establish itself. I'm talking about in terms of the relationship. One thing, building relationship, that's something that I did 2 doctoral dissertations, and forging relationship is always it's my pet peeve. So I believe in forging relationships, and the church has forged a relationship with the community. And because of that relationship also, the state or the elected officials and the people of the community are willing to trust St. Luke's because St. Luke has been there for the community. So it's good for the church to forge relationships with elected officials. And whenever there is something whenever they need to call on any entity, they know, oh, St. Luke's is there. We can call on St. Luke, and vice versa. Vice versa, we can call on them also when we need to get things done.
And may I, Father, another thing that is important is that we are not reaching out to our members. We already have them in full. We are reaching out to the general community. So whatever we do at St. Luke's is not for the members, it's for the St. Luke's community. So anyone can feel free to walk in and participate in whatever activities we're having, because it's not for us. We are already there. It's for the members, the people outside of the borders of the church. And to say the first time we had, it's just about 20% of the people were actual members of the church. The others were from the outside community coming in to be vaccinated. You know?
In the weeks and months since you've been doing this ministry, how is your community, your church community and your local community changed? Or how's it been affected by your work, by your ministry?
I would say that Dr. Grant can say a great deal about this, because what she's doing also in terms of, she has volunteered herself to, and has become the vaccination expert for the community. And you know, one of the things that we have in with the elderly, and also some of folks who do not have access to Wi-Fi, and to get to a vaccination site, you need to be able to register. And what Dr. Grant has been doing is to look for the site and call on people and register them. So she spends her time, thank God she's retired now, and she's willing and able. So she calls folks and she has a list, and she goes through the map, so to say, the vaccination map, and looks for the available vaccination sites, and she finds people.
And you know, so if it's not being done in your specific church at this point in time, you still want people to be vaccinated.
But I'm going to come back to the question you asked.
Other side.
So
yeah.
Because of that campaign, now we find that folks are more or less willing to come out. See, it creates also a level of comfort to know that more people in your community are vaccinated. Or if I can make statements, it gives you a sense of comfort to know that more of us are being vaccinated, and the more of us are vaccinated, the more. Every Sunday, I do education also on vaccination. Every Sunday, I have a little clip on vaccination, and also one of our wardens is a healthcare professional. She's I think the vice chair for nursing in the city. And every Sunday we have a clip, and the clip that I always invite folks to look at it, not from the eye angle, but more from the angle of how can I be used to, or what, it's not thinking about oneself, but more about the community. Because if I remove myself, then my action will impact other members of the community. Whereas if I allow myself to be vaccinated, so I'm not getting vaccinated just for myself, I'm getting vaccinated for the chain of people around me. So I invite people to look at it from that angle. So when I do not do it, it impacts not only me. Whereas I may be strong and I may say that, I'm healthy, I don't have to worry, but the folks around me, connected to me, those are the folks I want to protect. So it's really inviting folks to look at, to establish a more loving community, whereas we do things not for us, but for others.
And one of the impacts I have noticed since we have begun the campaign of vaccination is that people are more comfortable coming back to church, and they proudly walk with that vaccination card. You know, and literally, oh, I know you have been vaccinated. Yes, here it is. You know, it's like a passport to freedom, so to speak.
Amen to that. Yes.
Yeah, they feel very comfortable, very relaxed, and not looking, even though we are still separated by 6 feet and mask and all of that, they are not as anxious and afraid as they were prior to vaccination. And you'll hear one member saying to the other, I'll go out with you, I'll go to lunch, you know. After church, you could go to lunch, but you're not vaccinated. And that is sending a message that you should be vaccinated without saying you should be vaccinated. You know, or when we're vaccinated, we can get together and have and go back to lunch. Because we had a very active after service social life in our undercraft, in our common area, breakfast, lunch, whatever. But we cannot do that because of COVID. So people want to get back into some sense of normality, so they will go and take the vaccine because we are not dropping dead from the vaccine dose, so to speak.
If I want to look at it from a mental health point of view, psychological point of view, one book that comes to mind is by Paul Horton, Solace, the missing dimension in psychiatry, and in which Paul Horton speaks of the fact that in psychiatry, many times the concept that is not really focused on is solace. How do we enable our people to have a sense of solace? And I believe that being in the community is so involved in vaccination and reminding the education also has made possible for the folks who do get vaccinated to have a sense of solace. A sense of, you know, whereas, and we can tell you about St. Luke's, we lost 15 members due to COVID. And so we know the negative impacts of COVID. And with the vaccination, we can see that folks are more, and I don't want to say at peace, but a sense of solace, a sense of, yes, we're getting back to where we can live again.
Yeah.
We can enjoy life again. This is what we call in French, la joie de vivre, to enjoy life again. We can get to that point where we can enjoy sense of solace or joie de vivre or enjoying life. It's basically the same thing, or inner peace.
So, Dr. Bergquist, it seems like we're kind of entering a new phase. I know I'm in Colorado today, working with a church here. I was reading their local newspaper that their mass vaccination events are ending because over half of the people that are eligible to receive vaccines already have. Doctors' offices seem to be have more access to them. Seems like some churches around the country are beginning to open back up. A lot are still remaining closed. But what are you seeing in your work right now about what advice could you give us?
Well, first of all, I'd like to compliment both the other members of the panel. They've hit on almost everything that I wanted to say in terms of advocacy strategies for how to reach people. So it's amazing that St. Luke's in the Bronx is doing pretty much all the public health recommended strategies already, from serving as navigators for individuals in the community, serving as a vaccination site, serving as a clearinghouse for good information and goodwill for members of the church and the community, serving as a service provider for other associated needs, whether they be housing or food provision. So really, now if anybody asks me who's doing it right, I can now say, go talk to St. Luke's. They're doing, not only doing all of it, they're doing all of it right. So it's wonderful for me to hear all of those things. I think that role that St. Luke's is playing is going to become ever more important for all churches. Even if you don't decide to become a vaccination site, those, the vaccination sites in the community, like the pharmacies, like the doctor's offices, wherever a pop-up might be, if it's not for you to be a vaccination site, which it's great if it is, that's a wonderful thing, as Dr. Grant said, that I heard her say, and I'm going to paraphrase, that location sometimes matters. Location matters. That when they walk in the doors of the church, you feel something. You feel protected. You feel supported. Even if nobody says anything to you, just walking in the door of a church, your church, versus an auditorium or a convention center, there's a completely different feeling. So I do think location matters if people are interested in serving as a mass vaccination site. But given that we're getting away from, Reverend Jernagan, as you mentioned, so many people, now that all adults are eligible, and we expect 12 to 15-year-olds to be eligible probably next month for the Pfizer vaccine, as eligibility expands, and it's not a supply problem, it becomes more of a demand problem. So we're now, instead of looking for vaccines, as public health and as America, we are now looking for the people to receive the vaccines. So instead of what we were for these past 3 months, which is people looking for vaccines, we are now a community looking for people to receive the vaccines. And so it's important to know that there's several different pieces of this. The first of which that I want to mention is the equity piece. So there are many communities, whether we're talking about Black and Brown communities, whether we're talking about low socioeconomic status communities, whether we're talking about communities for whom English is not their first language. There's multiple different communities across the US who have not received enough messaging and enough support to believe in the vaccine. So that's one thing that's really important across, all jurisdictions and all churches, to help know where to direct people if they have questions, but also feel free to answer questions if they come to you. That if you've taken the vaccine and you feel comfortable sharing that with people, say, look, I took it, I feel great. As Dr. Grant was saying, I'm proud and thrilled that I can go to lunch now. I can get back some of the things that I lost over this past year simply by virtue of, somebody else giving me a shot. So that testimony, that self-testimony of yourselves or other trusted members of your community is incredibly important. So trusted members of your community would be the vestry, it would be the wardens, it would be any doctors, lay people who are just in the medical professions who could give testimony or, stand up and say, it's safe, or this is something that will really help us help others. So that last piece that I wanted to touch on is, again, something that St. Luke's touched on beautifully, is so much about the vaccine is self-directed, but so much of it is community directed, right? It's protective for you to get the vaccine, but it is also very much an act of service to others. And I think that message, I'm not sure that message has been given to people as much, that the fastest way for us to get one another back is to get vaccinated.
Mm-hmm. One thing that you mentioned also.
So I do want to interject quickly and just say to our participants, if anybody has a question, please type it into the chat box, and our panel will be happy to answer. Father Duvert, did you
One thing
have
that
something to
Dr.
say?
Bergquist mentioned is that the role that navigators play in the whole campaign, and especially in communities where you have the elderly who may not be able to access the internet. And I know in New York you have to register on you have to register, and not everyone is able. Some of our elderly are still using flip phones. So to ask them to go on the internet and register, and there comes the, so each one caring for the other, those who are more able to learn. And that's one of the messages that one of the teachings from our church, caring for one another. And Dr. Grant has taken on that role, and it's working well, especially with those who either do not have access to Wi-Fi, or the elderly, even if there was Wi-Fi in the house, would not know what to do with it. So it's good to have the navigators to navigate those who cannot do it themselves.
And just to touch on something Dr. Bergquist touched on, the testifying, our warden would go every Sunday, and she would look at, she'd say, okay, I had the vaccine yesterday, for argument, and today I got up not feeling as well, and be very frank and honest with what she's experiencing, and others who give her permission to say they have had the vaccine, and what the reaction is. Another thing that we have to keep in mind is that we have to be very, very, very honest in disseminating information about the vaccine. The people have to trust that what we are saying is the correct information, and not, all that is spreading out there on the internet regarding vaccine.
And one thing that I personally do, I go on the CDC and one show that I follow is the Rachel Maddow show, when she has a graph. Anything that is educational, it's on the PowerPoint the following Sunday and our services are viewed. We have a hybrid. We have a few people coming to church with social distancing, but most people follow on Facebook and Zoom and conference call, and everything is showed on the PowerPoint. So that information is shared with everyone who views who follows our services. And so education.
Hmm? And
so somebody's asked a very good question.
Yeah, go ahead.
Jackie Lois has asked, can you discuss the responsibility of the church to play a dual role to support members and community who will not receive the vaccine, nor have a willingness to be tested because they're fearful?
The role that the church, and then I'm going to go back to, again, education. I do believe that when people are provided with the information, the right information, usually people make assumptions about things because we do not know much about it. But when we are provided with the information, the proper information, and if the folks providing the information are folks whom we trust, then we are willing to take a leap of faith, so to say. So the church can play a role in educating, in an educational role, in providing right information about the vaccine, and also more about the virus itself. So I see myself, I do a lot of research. I do research. I have my background is education. I have one in educational psychology. So education is part of my training. And so I feel called not only to be the priest to settle with the Eucharist, but also to provide folks with our community with the knowledge that they need to make a rational decision. So the church can play that role as well. And again, as I said, folks are more willing to trust the church, to trust things when it comes from the church. So we need to be, as Dr. Grant mentioned, we need to be honest. And when we don't know, I can always tell folks, I don't know, but I'm going to research it.
Someone's asked a follow-up question. what do you say to counteract some folks who say the vaccine will contaminate your body and that you just do not need it because God will save you?
I always tell folks, now as a priest, I will tell folks, if you look at the book of Ecclesiasticus, and in the book of Ecclesiasticus, we are told that God is the one who gives knowledge to the physicians. Call on the physicians because they are empowered by God to help us. So yes, God will help us, but God will help you through me, through someone else. I see in the old days, in the Old Testament, God used to come. God would come and speak to Abraham, but now God, as I prefaced earlier in the Gospel of John, just as the Father has sent me, so I send you. God sent us now into the field to help one another, just as He sent the nurses, the physicians, the pharmacists, and the what is the word, epidemiologists? Yes, and the folks who are empowered by God to do the work of God. So it's a false understanding of spirituality to say God will save me. God saves me through sending someone. God delegates, so to say.
Yes. And in Jamaica, I'm Jamaican, as you hear my accent, we say God help those who help themselves. And by helping yourself, meaning you go to the people who God provide for you to help.
And I'd also ask the same question of our epidemiologist on the committee or on our discussion. What would you say to somebody who's hesitant?
I mean, I think for that particular question, I think my answer is remarkably similar to Father Duvert's, that we would not have been able to make the new vaccines without God's help. So just the same way that, God has helped us make all of the good things that we have, the vaccine is among them. I mean, I think of it in the reverse, that the vaccine is a gift from God, not a contamination. We're so fortunate and lucky to have it. Scientists work very hard to make it, and the fact that we were able to create a vaccine in 10 months for a completely unknown new virus in the world, that seems pretty miraculous to me.
A passage that I've used also is 1 Corinthians 12, where Paul tells us to each is given a manifestation of the Spirit for the common good, to some to be teachers, some evangelists, some, and so on and so forth. So the scientist is given a manifestation of the Spirit for the common good. So when the scientist says and is inspired to create the vaccine, it is through the inspiration of the Spirit. So the Spirit is not in a box only in quote unquote church things, whatever one defines as church things inside the church, but the Spirit is free to operate through all of us. And all of us are instruments of God's Spirit to do things for the common good. So the vaccine is a gift from God through that same manifestation. That's the angle from which I will take it.
Thank you. Are there any other questions from our panelists? I mean, from our participants? Well, okay. Well, I want to thank you all. This has been a really helpful discussion. And I think that it's one that we can hopefully revisit as we continue to enter hopefully positive new chapters as our society begins to reopen, and hopefully we're all worshiping back in church again soon, and everybody has been vaccinated, and we can continue to resume life. But to Father Duvert and Dr. Grant, thank you very much for sharing the story of St. Luke's with us. What I found so inspiring talking to you as we were preparing this, and also what I've heard you say today is how much it matters to be engaged in your community as a congregation. And that when you already have that, that standing of trust among even the people outside of your parish, but those in the community, it makes the ministry in times like these so much more effective. And to Dr. Bergquist, thank you as always for sharing your expertise with the wider church community. And it's such a gift and a blessing to have somebody with your knowledge and wisdom to share with us. And on behalf of the SEAT Network, thank you all for being here. And please fill out the survey. I always have to ask that. All right. Thank you all, and may God bless you in this Easter season.
God bless you. Nice meeting you all. God bless.
God bless you all.